As we come now to a close, I want to say thank you so much for joining us for today's proceedings. My name is Martin Seneviratne, and I'm one of the fellows with Medicine X this year. A doctor by background, now looking at digital health systems more from an academic perspective. And I feel like I've learnt so much today. It's been a really incredible day. We started really by hearing about some of the challenges that we face in healthcare. Right? And even as we sit here at Stanford in a place where all of the bells and whistles of modern medicine come together, there are some big challenges. Right? Andrea Downing opened the day with her personal story of navigating the health system and the benefit space as a patient. Then zooming out, Robert Pearl talked about how here today in this country, over 200,000 people die each year from vaccine-preventable diseases like pneumococcal sepsis. And we heard from Rusty Hoffman that over $40 billion are spent each year, a third of the education spend on a single surgery alone, spine surgery. So many inefficiencies, largely driven, it seems, by some unnecessary investigations, duplicated investigations, and poor information sharing at a systems level. Right? Dr. Pearl talked about these kind of ballooning healthcare burdens as the White Walkers from Game of Thrones. But I wonder, and I think this is a really a nice message to finish on, about whether we can prevent winter from coming. Right? We heard really that the benefit space can be this really interesting crucible for innovation. There's innovation in terms of increasing health literacy. In Dr. Hoffman's words, an educated patient is an empowered one and an engaged one. And that education can happen through really simple things like a card with 5 questions to ask your doctor, as Mary Beth Kudrick described, right through to the more advanced behavior change platforms like we just saw from Omada and Sean Duffy. Right? There's innovation in terms of increasing transparency around cost, and transparency around navigating this noisy cow farm that is the healthcare sector. And Collective Health and many others in the room are helping to facilitate that transparency. We heard from Steve Nealman about innovation around financial models and how to create sustainable spending patterns through models like health savings accounts. We heard about genomics. We heard about even how urban planning and architecture can promote wellness, right? Designing your car park a walking distance away from your building, like the folks at Overstock are doing, is actually a really important part of promoting health. I come from Australia, as you might have heard from the accent, and we are a predominantly public health system, which has its advantages for sure. But it seems to me that the benefit space as exists in this country can be this really interesting platform to be agile and to create customized care models that can help to be like almost a test bed for innovation and can help to drive system change at a bigger level. As Sean Duffy said, benefits managers really can be, the superheroes. Milt Ezard told us to be foxes rather than sheep when approaching benefits. Sally Wellborn told us that you don't need to be big, you just need chutzpah. And Mary Beth Kudrick told us it's not one big rock that makes waves in healthcare, but lots of little pebbles making ripples together. So be pebbles, be superheroes, whichever metaphor you choose, but nonetheless, it's a really exciting time to be at this intersection of technology and benefits. Here at Medicine X, apart from running conferences, we try and study this through an academic lens and have a research portfolio through the rest of the year where we investigate digital health care models, how to implement, how to evaluate, how to scale. So for anyone in the room who's interested in exploring that further with us, please do get in touch at any stage through the year. And with that, I'll hand over to our program director, Dr. Bassam Kadry.
Thank you, Martin. That was an amazing Cliff Notes. I wish in college I would have used them, summarize all my lectures. But in all seriousness, this event, something that's really unique about Medicine X, it's really not just an event. It's not just even a program. It's a relationship, and a lot of the guests in our audience come back. And for those of you who have been here before, I'd like just to see you stand up, just to maybe see some people who've been here. And what's unique about this event in particular is that this is the first time we're actually doing the self-insured employer market. The reason why we've landed on this is because, as we've heard throughout the entire day, is that this group, everyone, if not an employee, is going to be a patient, and it's fallen, sadly, on employers and that responsibility, and they're the ones who, at the end of the day, are going to probably want to take the lead on this. So we are actually going to commit the next 3 years to this topic. And this is something that I'm letting you know from now, so that hopefully next year when we look and maybe we could see what has happened with some of the companies and what they have done to share their stories, share their use cases, share even the things that they've learned from that didn't work. As Martin said, this is something that we do study, and any support for our program, our fellows, our students. The other thing is I want to take the time to thank, hopefully they'll come out, if you tell them, everyone, there's a lot of people behind the scenes to make this event happen. I want them to come out on stage, if they will come out, to recognize their efforts. I'm hoping. And we actually have some past members historically in the audience. If you're in the audience and you want to come, please come up. And what I do want to say is, without this team behind me, and there's a lot of others, none of this would actually happen. It really is a labor of love, and we really look forward to seeing you next year and the year after. And this is just the first day. Actually, believe it or not, the HCI, the Healthcare Innovation Summit, started off as one hour session several years ago that has then evolved into partial workshops and full days. And it's literally its own day. So we don't know what will happen in the future, but thanks to you, thanks to the staff, and thanks to a lot of the people, we're keeping this thing alive, and we hope that you come back next year. And if you have any questions or want to engage us, please don't hesitate to reach out to us anytime. Call me, email me myself, and have a wonderful day. There is networking outside and some refreshments, so we'll see you.